Can we continue now?
Yes.
So this is what you can see here. This is very good. This is vertebral column. So where is your spinal cord is present?
Inside.
Here or here?
uh,
Here.
number
This is what? This is body of what?
Body.
What is the location of the vertebra, the spinal cord? Here or in between there?
In between.
between this.
So in the foramina. So this foramina is actually the location of your spinal cord. This is actually body of that. So here is the body, and this is the location of your spinal cord. So nerves are coming on the side of that. So we need to see, this is what, this is your actually your spinal cord. So what you can see here, these are the this is what the peripheral nervous system going to become, the these are the nerves. So can you see here the plexus? The there are 4 number of plexus in your spinal cord. 2 at the upper level, 2 at the lower level. So at the upper level are the cervical plexus and the brachial plexus. So brachial plexus is mainly supplying what?
Limbs.
Upper limb, and the lumbosacral is going to supply your lower limb. So that's why there is enlargement at the cervical. So this here at this point you will see there is enlargement. So that enlargement actually show what? So brachial plex. So that is actually for the origin of your brachial plex. And same like this you will see there is a lumbar enlargement. So this plexus is actually supplying on the part of a specific part, but you can see this the thoracic vertebra, they are not involved in the any plex. So these are intercostal nerves. Can you see here? So these are simply going into thoracic part and supplying your the ribs and the thoracic part and thoracic organ. So they are not involved in the formation of plex. So there is two plex at the upper aspect and 2 at the lower margin. So and other thing, this is the what is the end point of your spinal cord? Where L2 and between the L1 and L2 mainly. So in actually the idea is that when in the embryological in the start of the embryology, in the development, the vertebral level and the your spinal levels are equal, they are quite similar, but as the life continue, so you will see something else. What? Because their idea is that the bony part is grow faster as compared to your soft tissue. So that's why the vertebra also continues to the sacral region. So but they end up right here. So they form a cone-like structure. So that cone is called actually this conus medullaris. So we need to talk in the next diagram. So actual picture. So can you see here? These are the spinal cord, spinal segment. So and you can see here they are end up right here at the L1 lower border. Can you see here? So what you can see, this there are how many cervical nerves? Number of the cervical nerves are
Cervical 12, 31.
total number of spinal are 31.
31.
But the cervicals are 7 vertebra but 8 nerves. So 8 spinal nerves are coming. So all these upper, because their number is 7, so of vertebra, but the nerve number is 8. So these 7 upper 7 are coming the upper margin of these vertebra. But if you see this the 8th one, they are coming on the lower margin or the inferior aspect of this C7. Can you see here? So so this story continue at the end. So you will see this the T1, T2, T3 all are coming on the inferior margin. Can you see here? So C7, C6. So they are coming on the lower margin of their corresponding vertebra. So although the spinal spinal cord is end right here, but you can see the nerves are coming at their corresponding opening, are the foramina through which they supply the body of that. So although they end here, so you can see the sacral nerve, although they are end here, but they came out at their if there is a S1, so they came out from S1 level. So if this is S2, they came out through S2. If this is L3, L4, L5, so although they are originating from L1 level, so but they came out of this vertebra at their corresponding vertebra. This concept is clear what I am saying. They are originating from their spinal cord, but out of the vertebra is their corresponding vertebra. So can you see, if you see here this for example S4 is coming from here, but they are not coming at this point. As S2, S3, S4, they are not coming right here, they are coming at their corresponding vertebra. Likewise the L3, L4, L5, so all they are coming on the inferior margin of their corresponding vertebra. So this concept is clear what I am saying.
Yes.
So there are although there are end of spinal cord end here, but the nerves coming at their corresponding vertebra. So we continue the remaining story. So this is actually your foramina magnum. This part is actually showing. So because the upper on the upper aspect of the foraminum is what? On the lower margin, the medulla oblongata. At the lower margin is what? On the lower aspect is spinal cord. So this is actually border of your spinal cord and the brain. So this magnum, foramina magnum, your medulla oblongata end, and spinal cord start from there. So this is, you can see these are actually showing two enlargement. So this is for the cervical, and this is for what?
Cervical.
The other enlargement at the level of lumbar, for the lumbosacral phalanx. So how many meninges layers? 3: pia mater, arachnoid, and the dura mater. So which one is inner, which one is outer? Dura inner.
Pia inner.
Pia mater, pad, PAD. Pia mater, arachnoid, and dura mater. So this is let's see, this is the level of L2 where your spinal cord is ending. So this is showing what? This is actually your pia mater. So they end up at the level of your coccyx. So although the spinal cord end here, but this meninges, this inner meninges, which is pia mater, they are not at the level of L1 or L2, so they continue to the coccyx. So they provide a strength on the back of your spinal cord. So like this. So upper margin is coming from your foramina magnum at the lower margin, and with the coccyx part. So they continue. So this part which you are seeing here, this is forming the phylum terminale. So this part which is after the conus medullare of your spinal cord. So this is what? Phylum terminale. What is this? This is what? This part you are seeing. So this part, phylum terminale. After the ending of your spinal cord, the remaining story of your pia mater is the phylum terminale. So this is phylum terminale, and which is end at the level of coccygeal. And this part you are seeing, this layer is what? Arachnoid. So and this part which is under the arachnoid, we name them what? Subarachnoid. What is showing here? This fluid structure you can see. This is what? CSF. So your CSF or cerebrospinal fluid is present in the subarachnoid space. So subarachnoid is the actual location of your CSF. Where is CSF is originating? What is the origin of your CSF?
CSF is
Also brain. What part of brain? Ventricle. So they are actually coming from the ventricle. So what part of ventricle? All right. What part of lateral ventricle? There is something choroid plexus. Choroid plexus. So they are what? They are simply the modified capillaries. So they originate from these ventricle and continues through the ventricle into the subarachnoid and they are enter into the subarachnoid space. There are also these three layers are also present in the brain as well as in the spinal cord. So this is the what is remaining one? Pia matter, arachnoid, dura matter. So this is the dura matter. So the under part is the subdural and the outer aspect of the dura is what? The epidural. So these spaces, so the important epidural space, subdural space, subarachnoid space. So we have to talk about them in the next lecture, but just naming right here. So this is the there where they end. They end these two layers, arachnoid and your the dura is end at the level of S2 and the spinal cord end at
L1
and between L2. So this outer layer is the dura mater. So and the space which is outside of the dura is epidural. On the inner aspect of this is what? The subdural. So this is actually this is showing what we take for the therapeutic and CSF. So this is injection they are putting right here to take the CSF. Why we not put right here at this level? And this is the best side. Why this is best?
क्योंकि सबसे ज़्यादा यहाँ पे
They are present here.
concentration.
No, we cannot compensate to injury of your spinal cord. You can see spinal cord and here. Our concern is with mainly with the CSF. So CSF is present here. Why we should take a risk of the injury of the spinal cord? If I put this needle here, so I may injure the spinal cord.
Yes.
So I cannot go down to the S2. Why? Because there is no and the subarachnoid space. So we can take easily CSF. So best site is the L3 and L4. So take this. These are the reference point. So if you look at the iliac crus, so if you continue this is actually the reference point for your L3 and L4. So put this needle here and take the CSF and use for what that is needed. Okay. So you can see here here is the your spinal cord end. This part is what? Conus medullaris. So this cone shape structure is conus medullaris. And can you see here this phylum terminale? Can you see this is continuation of what? No. Phylum terminale is what? I've already mentioned. A PA matter from after the L1 and L2. So if you see this part, this green color is showing which is end at the coccygeal. This is what? The phylum terminale. So here you can see this is phylum terminale which ends at the coccygeal part. But if you see the dura and arachnoid, so they all end right here. Can you see?
Yes.
So they are ending right here. So phylum terminale continues. Can you see the phylum terminale is continue here? So they end at the level of coccyx. So you out of three, the pad P is ending at the coccyx. The dura and arachnoid end at the level of S2. Your spinal cord end at the level of L1 and L2. So these ending points are very important. So for your PG exam as well as your board exam. So step 1 exam. So you can see. So the nerve, as I mentioned, the nerve which are coming from their spinal segment, but and came out of the vertebra of their corresponding vertebral level. So if the nerves of the L3 is coming from here, so they end out here. So S2, S3, so they are coming right here. So they form a horse tail like structure. So that horse tail structure is actually called the cauda equina. Cauda equina means simply mean the horse tail. So this structure is actually forming the. So these are three layers: the dura, arachnoid, and the inner one is the pia. So we need to talk about, we already mentioned. So can you see here? So this is what, this is your spinal cord, and the central part you can see is the interior median fissure. So we need in the we discussed in the next part. So this is what, when you see pia, and this is the denticulate ligament, which actually the PMA in between these meninges, which actually gives supportive role in maintaining these the meninges. So denticulate ligament, and here is your arachnoid mater, and here is your dura mater, and these are the blood vessels of your spinal cord, and here is the dorsal root, here is the ventral root. So what do you mean by dorsal? What do you mean by ventral?
dorsal जो ऊपर वाला
No, no, simple dorsal and ventral.
Dorsal teaching is actually dorsal.
Ventral. Ventral something in front, the dorsal something in back, or interior and posterior. So the nerves which are coming back of your the dorsal aspect, they are actually supplying your back of body, and which are coming on the ventral aspect. So the branch who actually they come, so they are ventral rami, they are actually supplying your interior part. So what, dorsal or ventral, which one is involved in the formation of plex?
dorsal
No, dorsal is actually supplying your back of body. So the ventral part of ventral rami is actually forming the brachial plex, cervical plex, lumbosacral plex. So all these plex are actually coming from your ventral part. The dorsal part is actually going to into the back of body. So they are not involved in the formation of any plex. This concept clear? Oh. So this is spinal cord, and here is the end of your spinal cord. So epidural anesthesia. So these are different injection put right here. So I think this. So these are three layers of your brain. This is pia mater, inner one, arachnoid mater, and the dura mater. So what do you mean by ventricle? What are the ventricles? These are actually cavities. So they are actually the CSF. One of the important function also is the question. The other is to make lighter your brain. So they make the weight of your brain light. So you cannot feel the weight of brain. Can you feel it in the something here? No, because of this ventricle CSF fluid. So although they are providing protection, and other thing is they make our brain lighter. So if you sometime you have visited the swimming pool, you have seen something is heavier on the outside of water. When you put that thing in the water, their weight becomes less. Have you observed sometime?
yes
Something if you have taken is 20 kg, but if you put that thing in the water, so their weight becomes shorter or less. So this is the property of the fluid, a liquid thing. So when you put something in the fluid, so their weight becomes less. Although our weight of our second brain is around about 1.5 kg, but when you put in the, due to this CSF, we take only almost 2 or 3 200 to between 200 and 300 mg. So because of this CSF fluid. All right. So these are actually, here is the lateral ventricle, and the other is, here is what, third ventricle. So from the lateral ventricle there is a foramina. So interventricular foramina here. So foramina Monroe, and so the CSF produced here and came out here and continues through this cerebral aqueduct, which is associated with your midbrain, and it continues enter into the fourth ventricle. So the fourth ventricle, through fourth ventricle, it is actually entering into your spinal cord central canal. So central canal. So this CSF also can come in the central canal. So and here through where it enter into the subarachnoid space. So you can see here lateral ventricle, third ventricle, and the fourth ventricle. So the very important. So when you discuss these ventricles, so the floor of fourth ventricle, you have to discuss their boundaries importantly. So this is associated with mainly the midbrain, and the here is what, this part is what, here is what, pons, here is what, midbrain, here is what, the medulla oblongata. So this part is associated with your brain stem and between the cerebellum. So upper two are present right here, and I think you are much more clear right here.
Yes.
So these are the meninges which are important for the protection, and the cerebrospinal for the cushioning. So now come to the PNS. How many nerves? Cranial nerves? Pair. Cranial nerves. Not 12 pairs of cranial, and the spinal nerves 31. So they are actually forming your the peripheral nervous system. So one part is the sensory, one part is motor. So sensory, which is coming from your receptor, coming to the your CNS or spinal cord. So if you look at here, so for example, take a, so the nerves which is coming from here, so for example the sensory nerve present here, so the receptor present here, so the signal coming like this, move like this, so this is all about the peripheral, so enter into our spinal cord. So this is the sensory, so this is sensory nerve, but enter into, for example here, so in the cervical, so when they enter, they ascend into our cerebral cortex in the area of their sensory areas. You know better what is sensory area of cerebral cortex. Frontal, and the frontal is motor part, and your parietal is the sensory part. So they come enter into your sensory area. So this is ascending. So this nerve, which is sensory nerve here, but in the CNS, this nerve's name is replaced by the tract. So outside in the PNS, you use the term nerve. Inside the CNS, what term is replaced by tract, sensory tract. You cannot use the word the sensory nerve in the CNS, in the spinal cord or your brain. So the term is for the nerve or the axon fibers, which are actually, so they are what, the tract. And the outside in the PNS, the term is the ganglia. Inside the CNS is what? Nucleus. So are you familiar with this term? So nucleus and the tract is for the central nervous system, and the nerve and ganglia is term used for the peripheral nervous system. So this is the ascending the tract, and the motor, which is coming, taking signal from motor areas and coming back and act this muscle, I contract my muscle. So this is the descending are the motor nerves, motor tract, and the ascending are the sensory tract. I think this is clear what I am saying. So there may be a somatic, there may be a visceral or autonomic. Somatic, which are our under control, and the autonomic are what? Are those which are not in our control. So what is the area of action? What are the effectors of the autonomic? Effector site for the autonomic is what? For somatic is the skeletal muscle. For autonomic, what is the effector site mainly? No effector site. For the somatic is the skeletal muscle. For the autonomic, what type of muscles? Smooth and cardiac muscles. Smooth and cardiac muscles are the effector site for the your sympathetic as well as your parasympathetic, and if you look at the somatic is the mainly skeletal muscle, and the cardiac and smooth muscle, and third one is the gland, exocrine as well as your endocrine. So what is the sympathetic condition? What is parasympathetic condition?
Rest condition is parasympathetic.
And the fight and flight condition is so easier trick to remember the which one is the rest condition, which one is the fight and flight. The alphabet R, rest. So in the parasympathetic you find the word the R, which is showing this is related to your parasympathetic, for just for trick. So parasympathetic is actually rest condition, and so what is the site of origin of your sympathetic? What is the site of origin of your parasympathetic in the spinal cord or your brain? For sympathetic, what? Thoracolumbar. Thoracolumbar is the actually from T1 to L2 level is the site for the sympathetic. For the parasympathetic, cervicosacral. Cervical is part of the origin of your parasympathetic. Are you clear?
Yes.
So the spinal nerve are 31, you know better everything. So we can. So this is the actually the nerve. So what do you mean by nerve? How can you define the nerve? You know better. There is cell body, there is dentate, there is axon, part of neuron. So these are axon, which we call them the nerve fiber. So likewise your muscle. So there are the nerve fiber. So these nerve fiber actually forming the nerve fasciculi, and these nerve fasciculi are actually forming your nerve. I think this is clear. So we have to look at that picture. So nerve, ganglia, nerve fiber, you know better everything. So this thing you are seeing is what is the nerve fiber. So we are just going to the connective tissue which cover the endoderm, the endoneurium, perineurium, and epineurium or ectoneurium. So this is what nerve fiber. So this is covered by something. So that is the endoneurium, which cover the nerve fiber. Nerve fiber is simply your axon, or nerve fiber is same thing. So endoneurium. So this is the other nerve fiber, which is also covered by what? Endoneurium. So these are different. The nerve fiber covered by endoneurium. Can you see? So there are bunch of these nerve fiber. So you can see they are covered by what? So when this group of nerve fiber is actually forming your fasciculi, so nervous fasciculi. So there is covering for this complete set of the nerve fiber is, can you see here the covering right here? So this is perineurium. This is what? Perineurium. So there are different. So now the nerve fascicular are actually trying to form the nerve, actual nerve. So can you see here these are bundle of these nerve fasciculars. So 1, 2, 3, 4, 5. So these are what? They are forming a nerve fiber. So the covering of the nerve is what? So can you see here another covering? So this covering is what? Epineurium. So can you clear? Yes. What I am saying? The nerve fiber covering is the endoneurium, the nerve fasciculus covering is the perineurium, and the covering of this complete nerve is the epineurium. And you can see this is what? Nerve fasciculus, and their covering is what? Perineurium. And this is nerve covering is the epineurium. And this is what? This nerve fiber and covering is the endoneurium. Are you clear?
Yes.
So this is actually structure. You can see here the endoneurium inside the hair. So this is actually covering of this is the endoneurium, and here is the perineurium covering of fasciculus, and the covering of your complete nerve is what? Epineurium. So when you try to pick a nerve, grip a nerve, so you are actually touching the what? Epineurium, perineurium, endoneurium.
Epineurium.
Of course, the epineurium. So this spinal nerve. So these nerve fibers, which are you are seeing, are axon. They are covered by something. We name the. Here is what? Myelin sheath. Can you see here?
Yes.
So these are actually these nerve fiber or axon are covered by myelin sheath, and in between these fascicles, you can see these are what? Blood vessels, which are trying to supply these part. So this is cross section of your nerve. So epineurium, perineurium, and endoneurium. This is somewhat complicated as compared to last picture which we have seen already. So if you are clear with that, it is easier.
Yes.
So in between you can see the blood. So the spinal nerve or spinal trunk, if you are trying to pick, that is actually epineurium. So here is what? The spinal cord. So we are just trying to target. So now see this picture. So this central part, can you see this part? This is gray matter. Outer part is what?
White matter.
White matter. What is gray matter? What is white matter?
Gray matter inside the
Gray matter cell body,
Yes.
cell body or white matter axon, yeah, nerve.
Axon. So the myelinated axon are actually forming what? The white matter. And the unmyelinated axon or the dendrites or the cell body, they are actually forming your gray matter. So in the spinal cord, gray matter is on the inner aspect, and the white matter is on the outer aspect. But if you look at the brain part or your cranial part, you will see the white matter come on the inner aspect and gray matter come on the outer aspect. Is clear what I'm saying? So here is the gray matter on the inner aspect, white matter is on the outer aspect. So let's discuss the part of gray matter and the part of your. So this is what? Gray matter, and this is what? White matter. So this gray, can you see horn on the back, on the front? So this horn.
Brain decides a 6 merit spinal cord with curves a 9.
So on the back of your body is the dorsal horn, on the front of is the ventral horn. So these are parts of your gray matter. This is the ventral horn, this part, and this is the dorsal horn. So like this. So there are two dorsal horn, there are two ventral horn. If you look at and in the center, this number 1 is what? This is actually your central canal. This is what? Central canal. If you look at the white matter, so there are 3 parts mainly. So this part, which is the dorsal part or the posterior part, this is the dorsal funiculus. Dorsal funiculus, and here is what?
Lateral funiculus.
Here is what?
Lateral funiculus.
Lateral funiculus. So this part is for the the white matter, the part of the funiculus, dorsal, lateral, and the ventral. For the gray matter, the horn, ventral horn and the dorsal horn. So something special right here, that is the lateral horn. So this lateral horn is not present throughout your spinal cord. It is only present at the level where your sympathetic nerves are coming. What is the level of the sympathetic? T1 to L2 or L3. So this is only present, this lateral horn is only present at this level from T1 to L2 and L3. This concept is clear what I am saying? So you can see here, so this is dorsal funiculus, and something you can see here, the fasciculus cuneatus and gracilis. Right? This is actually the part of your dorsal horn. So on the inner aspect, so the medial aspect is supplied by your lower margin of your body is supplied by this medial part, and the outer part is supplied by the lateral part. So for example, the upper part, your upper limb or this part is actually controlled by this. So idea is that your ventral part is mainly associated with the motor, and your dorsal part is actually sensory. So the sensory nerves enter into this dorsal half, and your motor leave this ventral part. So ventral half, and the lateral is for what? Sympathetic. So now come to this picture. So what you are seeing, this is what? Gray matter. This is what? Central canal, and this is the white matter, and here is the interior part, there is posterior, and this is the white matter, this is the gray matter. Are you clear? So now see the pattern of the formation of the sensory, the motor, and the sympathetic. So ventral horn, here I am just focusing this part. So this part, so here is what? This is the cell body of your motor neuron. So from there you will see this something coming out. This is what? This is nerve fiber which is coming out of that. That is the motor fiber in the ventral horn. So they are coming here out of that in the vertebral foramina. So this is the ventral root. So this is ventral root. So, and if you look at this part, this is the dorsal root ganglia. Ganglia is what? Collection of cell body. So inside there is a nucleus. Outside there is the ganglia. This is the inner part of your CNS. This is ganglia. This is the nucleus. Are you clear? So this is outside, because this is the spinal cord. This part is out of that. So we call them the dorsal root, on the back of dorsal root ganglia. So what you can see, so this is actually pseudo unipolar type. So this is sensory neuron cell body. So something coming out from this pole, so they are actually entering into this dorsal horn. So these are the sensory. So they receive from where? So they are actually receiving your the signal from your the peripheral nervous part. So they are entering right here and enter into the back of your spinal cord. Are you clear? So this is the sensitive fiber in the dorsal root. So this is dorsal posterior root, and can you see a sympathetic lateral horn? So these are what the sympathetic neuron coming from T1 to L2 level. So what you can see here, this is the nucleus for the sympathetic. So something coming out, this is nerve fiber, which is a sympathetic fiber in the ventral root or dorsal. This is ventral root or dorsal? Dorsal is back. Are you sleeping? Ventral root. So the sympathetic fiber are in the ventral root, and the motor are also in the ventral root. Are you clear?
Yes, sir.
So this is what. So actually, your somatic have a single nerve fiber which is coming, but in the autonomic there are two neurons. One is the preganglionic, one is the postganglionic. The preganglionic before the ganglia, postganglionic after the ganglia. So here is the site of your, this is the ganglia. So this is sympathetic ganglia. So this part is, can we see this part which is before that is called preganglionic, and this part is what? Postganglion. So there is preganglionic coming at the sympathetic ganglia and reaches into the and this is postganglionic, which is going to supply the area where they have to supply the sympathetic area or parasympathetic. So this is what? This sympathetic trunk ganglia with the postganglionic sympathetic neuron, and so this motor sensory sympathetic, this complete combination is actually your spinal nerve. So sympathetic, the motor sensory, all they are actually, this collection you are seeing is actually your spinal nerve. Are you clear?
Yes.
So sensory is coming on the posterior dorsal aspect of your, and the motor are coming out of ventral part, and the sympathetic are also coming at the ventral part. So now you can see this picture. Now this is what, this is central canal, ventral horn, Mr. Suglan. So central canal, ventral horn, dorsal horn, and here is what, the dorsal root, sensory neuron coming right here on the back, and the ventral the motor neuron coming out here. So these are forming the mixed. So mixed means both the sensory as well as the motor. Yes. So they are actually, you can see this motor is supplying your muscle, and the receptor gives signal to through the sensory neuron into the back of your spinal. So this is actually interneuron. So you can see this is white matter, gray matter, and this is what, here is what, sensory neuron. This is dorsal root ganglia on the, which is part of your sensory pathway. For the motor pathway, there is no ganglia outside, so their nucleus is present in the ventral horn. So if the level is T1 to T1 to L2, there is a sympathetic. So now look at the sympathetic pattern. So if you look at the, what you can see difference between the C8 and T1. So at which level your sympathetic should be present, at which level your lateral should be present at R. So at the C8 should be absent. Can you see here? So this is what, here you cannot see the lateral horn, but you can see here this is lateral horn. At the, so this is actually your C8 level, this is your T1 level. Can you see difference between the C8 and T1 level? So what you can see, this is what, this sympathetic origin for lateral horn in the lateral. So this nerve, this is what, preganglionic. So these fibers which are coming out of this nucleus is what, preganglionic, which this is ventral root, this is dorsal root, you know better. I am not going to detail, but just mentioning the sympathetic pathway. So what you can see, these are the paravertebral. Paravertebral means parallel to your vertebra. So that is actually your paravertebral sympathetic trunk. So you can see here. So they are coming here. So this is what, this is sympathetic trunk ganglia. So from here, so this part through which they enter, this is white ramus, and through the out is the gray ramus. So this is what, the ganglia, sympathetic ganglia, trunk ganglia, and this is what, postganglionic fiber, and so they are the fiber which are coming out. So they are the dorsal posterior root, and here the ventral part, and this part is gray ramus through which your postganglionic out enter through white ramus communicates. So this part is supplying their corresponding site, but for what will happen if I want to supply the sympathetic part above the level of T1? So there is no lateral horn above the T1. So this part, this is actually forming your this paravertebral sympathetic trunk, which is actually going to supply your upper part and lower part. What is mechanism? Let's see. So on the lower, so this part is actually going to supply, and on the upper aspect you can see this is what, postganglionic fiber, so which are going to supply the at the level of C8 or the upper margin. So they cannot take origin from their lateral horn because that is absent in their corresponding level, but they can take advantage of this paravertebral sympathetic trunk to take their sympathetic supply. So this is what, gray ramus. So can you see here the white ramus here? No. Why? Because there is not site of their sympathetic. So in the, at the level of T1 to L2, the what is absent? The white ramus is absent. White ramus is present, but the white ramus is absent above the T1 and below the L2, L3. Are you clear? So this is the other part. All the sympathetic thorax arise from T5. So So these are fibers which are coming out. These are superior cervical ganglia at the level of cervical. So this is your ganglia. So they are actually going to supply the head and neck region. So to the head and neck from T1 to T5. So sympathetic of T1 to T5, they are going to supply the sympathetic to the cranial part or head and neck part. So at the thorax part is supplied by T5. So this is your lower margin. So I think this is a clear picture.
Yes.
So last just one or two slides are remaining. So this is cranial nerve. How many pairs of cranial nerves? 12. So how many can you name the cranial nerves which are the mixed, which are the sensory, which are the only motor? So what do you mean by mixed?
Both parts are sensory and
Sensory and motor, both, if they are both are present, we call them the mixed. So just remember the first and something first and something 2018. So 2, 1 and 8. 2, 1 and 8. These three are actually your sensory. 2, 1 and 8 are the sensory. First and from the first and F 5, 7, S. These, if you continue with the spelling, so F represent the 5, S represent the 7, T represent the 10, and N represent 9. So 5, 7, 9 and 10, these are the mixed, and the remaining are the motor. Are you 5, 7, 9, 10? So these are the mixed, and 2, 1 and 8 are the
2, 1.
and 8 are the sensory. These three are sensory. All remaining are the motor. Are your other mnemonic in your language? पसंद 2018 समथिंग. सो 2018 2, 1 और 8 जो है वो सेंसरी को ज़ाहिर करता है, और जो पसंद 5, 7, 9, 10, सो ये जो है ना किसको ज़ाहिर करता है? Mixed को. So first and are you continue with the first and something 2018. So whichever mnemonic you want to use. So these are different parts. So in the next lecture, my request is to come with at least you able to name the cranial nerves: olfactory, optic, oculomotor. So these are three: trochlear, so abducent, trigeminal, facial, vestibulo-ocular, glossopharyngeal, vagus, accessory, hypoglossal. Olfactory for what? For olfaction, and the optic for the vision. For the, and the oculomotor is going to supply the muscle of your eye. So all muscle are supplied by oculomotor except lateral rectus and the superior oblique. So for the lateral rectus, their function is, what is the function of lateral rectus? Abduction of eye. So for that is this abducent nerve 6, and for the superior oblique, for the superior is the SO4, superior oblique SO4, 4, that is what the trochlear, and trigeminal is for the muscle of mastication, and the sensory is areas of your face. And if you they look at the facial, so muscles of face are mainly supplied by the facial nerve, and the vestibulo-cochlear is hearing and the balance. So one part is the vestibular and other is the ocular part. So cochlear part, sorry. And glossopharyngeal is
larynx.
Yes. So and the vagus is mainly concerned with the so the thorax part and the abdominal part are your the larynx and pharynx muscles.
Some part of ear.
So some muscles. So if you look at the accessory, 2 muscles only, the sternocleidomastoid and the trapezius. These 2 muscles are supplied by accessory nerve. So accessory, spinal, and the hypoglossal. Hypo mean what? Under, or glossa related to the tongue. So the interior 2/3 of tongue is supplied by facial, and the posterior 1/3 is supplied by
Salivary glands, sir.
uh,
Salivary gland, what see?
so that is third arch. So facial and interior is supplied by anterior 2/3 is facial, which is called the tympani, and this hypoglossal, which supply the muscles of your tongue. So this somatic autonomic, I have discussed the somatic part, which you can see there is single neuron, and for the autonomic you can see this is preganglionic, and here is the postganglion, here is the ganglia. So there are two fibers in the autonomic, and there is single, which is, you can see here is the myelinated part, and this preganglionic is the myelinated and the postganglionic is the unmyelinated. So you can see this picture, so different part. So thoracolumbar, craniosacral part, you can go through all of that. So we just sympathetic rest condition. So don't confuse your sympathetic and parasympathetic. Sympathetic is condition of fight and flight. So what will happen to the eye in the fight and flight? Dilate. Pupils will be dilated, and the heartbeat should be
Increase.
respiration should be
Increase.
digestive system should be so digestive system
Digestive system.
slow down, decrease, not increase. So these are actually sympathetic condition. For the parasympathetic, opposite, rest condition. So your digestive system goes faster, and your cardiac and the respiration not lower, they actually come back to the normal. So these are different parts. So lung constriction, intestine level, urinary bladder. So we end up this lecture organization. In next lecture we will continue with the ventricle and the meninges, so and other things. So thank you very much. Allah Hafiz.